Good day. Hello again. This is Dr. Garcia, and now we will be talking about wellness and periodic health examination. For this lecture, we will be defining wellness, the dimensions. We will be describing what is a periodic health examination, and we will be discussing the importance of periodic health or wellness exams or checks. William Shakespeare said it best when he said, "Our bodies are our gardens, our wills are our gardeners." So we should be taking care of our bodies. So, to be more specific about the definition of wellness, it is a proactive process meant to achieve a meaningful and fulfilling life. It is conscious, self directed, and a continuous process. It's also an active lifestyle that incorporates several components that affect health, your physical, mental, and social well being. So basically, it's a holistic concept. Now, according to the NIH, it is an active process through which people become aware of and make choices toward a more successful existence. The WHO, on the other hand, simply defines it as an optimal state of health of individuals and groups with two cardinal concerns, which is the achievement of an individual's fullest potentials and carrying out the individual's expectations in the family, community, workplace, and other settings. Now, what is the difference then of health and wellness? So basically, there's a very, very thin line between two, which is why, for the most part, it's been used interchangeably. So for the WHO, it's basically the state of complete uh, physical, mental, social well being, but not merely the absence of disease or infirmity. So highlight on the state of well being. Wellness, on the other hand, is defined quite similarly in that it is an optimal state of health, as mentioned in the previous slide. So, to put it simply, the difference is that wellness is basically a state of actively living a lifestyle that helps to attain good health. So, I hope that clarifies the difference between the two. Now, to further delineate wellness from health, let's go into the dimensions of wellness. Okay, first, we have the physical dimension, which is concerned with cardiovascular fitness, strength, flexibility, and other things. These are activities that may be carried out to improve physical health, which include your exercise, diet, and close observation of health indices, including your stressors. Now, your emotional or psychological wellness dimension is associated about attitudes and beliefs about yourself, your life. So it entails your self-view, which should be positive. Okay. Next, we have the social dimension. Now, this basically refers to the interactions or connections you have with other people in the community. The intellectual or cognitive dimension is basically self explanatory. It refers to knowledge acquisition and intellectual activity and how this affects your well being in general. Okay, so basically, when you know things, it affects how you do things and how you live your life, right? So the occupational dimension, of course, it is concerned with personal fulfillment and satisfaction from paid or non-paid jobs, and it encompasses or includes one's ability to handle multiple roles. Now, for the environmental dimension of wellness, it's sort of related to the social dimension, but is made up of individuals, homes, your basically the environment or your surroundings. It's concerned with your interaction with your environment on both the local and global levels. Next, we have your economic wellness. It helps with the assessment of institutional public policies, which basically affect the wellness of all individuals. Now, for your spiritual dimension, it basically relates to your purpose or how you view your meaning in life, okay, and how it contributes to wellness. Now, for the cultural dimension, this is basically referring to how individuals live in a democratic, individualistic settings. Okay. not the more authoritarian ones. Now, lastly, we have the climate wellness. This is quite different from your environmental, although there may be some confusion between the two. So, this is actually an emerging dimension of wellness, and it looks at the connection between the ongoing climate changes and overall human well-being. So, there are already studies out there in which they've shown that climate change has had significant effects on our health and wellness. Okay, so how do we make sure, or how do we maintain our wellness? So this is where your periodic health examination comes in. So these are basically recommended screening tests and schedules for both the general and selected populations, okay, in order to monitor and surveil for disease. It is a form of primary level prevention in which you screen healthy individuals for certain diseases, especially those at risk. Okay, the focus of care is preventative, and it focuses on the early stage diagnosis of disease. Now, for healthy individuals, this concept refers to age appropriate screening tests, whereas for special populations, those with risk exposure and risk factors, they have specialized screening tests. Now, the main purpose again of this periodic health examination is to screen for risk factors in disease, assess and evaluate those risk factors. You should then monitor the health status of your patients and provide preventive lifestyle interventions and educate them as to how they're going to go about maintaining their wellness or their well-being. So the acronym here is SAMPLE. Okay. Now in your manual, there's quite a very long table there, which summarizes the recommendations in the latest CPG on periodic health examination. So basically, it indicates recommended screening tests for the following. So those are all the diseases that were uh, aimed at in that set of recommendations. Okay, in summary, to achieve optimal health, wellness interventions should target all the dimensions. And the regular assessment of health, specifically periodic health exams, are important for prevention and early detection of disease. So let's remember, it is health that is real wealth. Okay, so you should take care of your bodies always. So thank you very much. You may send in your questions through Canvas, or you can approach me when we meet face to face. Thank you for listening.